I'm here with Elizabeth. She's 39 weeks pregnant, and today we're going to go over the biophysical profile. So she is the perfect age, fetal gestation age, for us to check. 4 things we check with our biophysical profile: fluid, fetal tone, movement, and breathing. So the first thing I always do when I put the transducer down is I want to know what position the baby's in, what's presenting. And for Elizabeth's baby, it is her head. And you can see, as you can see here, the further along you get, the harder it is to see. This baby's head is so far down that I can just barely make out anything more than the fetal skull. So you can see the skull here. And as I travel north on mom, I'll see, okay, so there's baby's chest and heart. Spine is maternal left. So I'll follow the baby towards mom's head, fundally. And I'm coming into bladder. There's baby's bottom. And this, when I'm doing this, I'm getting a sense of the position of the baby, and I'm also checking the fluid, just for an overall assessment without actually measuring it first. So here's femur, here's placenta. As you can tell, it's aging there. It's been in there quite some time, ready to pop the baby out. Here's a nice fluid pocket coming into baby's face and head. So I always start with breathing. That overall assessment is really just to get fetal position, check the placenta, and just get an overall fluid assessment. You'll know if the fluid is too low because all you'll see are parts: arm, leg, body, and there's no fluid in between. It makes it really, really hard to see. So that's kind of what that first assessment is for. Next, I'll go to the fetal chest, because if you sit on the fetal chest and wait for breathing, 9 times out of 10 the baby will move while you're doing that, and you can count movement while you're counting, while you're looking for breathing. So if you go sagittal on the baby, and I do that by taking my transducer and turning the notch towards mom's head, I know that's the sagittal plane of the baby, because the baby's head's here and bottom's here. So in order for me to see the baby in a sagittal plane, I'll have my transducer in a sagittal plane to mom. Vice versa, if I want to see the heart, I would want to see that in a transverse view, or the fetal head. This is like kind of CAT scanning the baby all the way down: head, chest, abdomen, bladder. So let's go back. So there was a little movement there. You could feel that. And let's go back to the chest in a sagittal plane. And you can see on the screen the baby's diaphragm right here. You can see the heart, ribs, and diaphragm. And here's where I like to sit. Here's fetal kidney. Here is a little, we want 30 seconds of breathing in a 30-minute period. So I'll just check, and you'll start seeing when the baby starts breathing or doing some practice breathing, you'll start seeing the chest move up and down in this position. So we really just sit and we wait until you can start seeing the lungs move up and down. And while you're here, you want to check and see, the baby may want to roll, or she'll kick you, and you can count that for movement as well. So we'll just sit here for a second and see if we can't see the baby. Do a little practice breathing. There she goes. You see it move up and down. And most systems have a little clock up here, and you can check the seconds here. She's still going. That's perfect. That's a nice, healthy episode of breathing. So we'd give her 2 points for that. Baby gets 2 points.
2 points.
2 points. So after we see that, we'll move to, what I like to do to get tone or movement is go to a limb or to check the spine. So if we like to go to arms and legs, I'm sure you feel her kicking like on this side. And you can always ask mom, where do you feel her kicking the most? And wherever mom says, so, okay, I'll sit over there and wait for her to kick me. And a lot of people ask me, what's the difference between movement and tone? And when you think of tone, think of a return back to where it came from. So if the arms are like this, tone would be an extension and flexion back to a return. Same way with the spine. If the baby's curled up like this and it stretches and then comes back, that's one episode of tone. You only need one episode in a 30-minute period of tone. Same thing with the legs. The baby could kick and return back, and that would count. Movement is a little bit different. Movement would just be either the baby will roll or turn its head, and an episode of a tone can count for movement, but not vice versa. While you're waiting for movement, you can do fluid assessment. We can do an AFI. When you start the AFI, you want to finish it, but with tone and movement, you can look for other things and it will happen while you're scanning. Oh, there's a little movement there. That's her kicking up into to the placenta. So we can count though. That's two movements. Let's talk about fluid assessment, and while we're doing that, I'm sure that she'll kick or flex her foot. Oh, there we go. Kind of hard to catch, you can feel it. When we start with the fluid assessment, you want to divide the body, and we have another video lecture on just an AFI. But as far as considering it part of your biophysical profile, you want to divide the body into 4 quadrants, straight down the middle, and then across the belly button here. And we'll start in this quadrant. If you put on color, you can make sure that you don't have any cord in the pocket. So a couple of things you want to watch out for is to keep your transducer perpendicular and to make sure you don't have any cord in the picture. So if you use color, if there's cord, it'll light up nicely. So you can go to your calc package and go to AFI, and this is one quadrant, and you want to do the anterior to posterior measurement. It doesn't matter if you're longitudinal or transverse, just as long as you're perpendicular. And you also want to make sure that you're not putting too much pressure on the baby. You can actually squish the fluid like that. So you want to just do a light touch on top of the belly in a transverse, more perpendicular fashion. So see all this cord here. And if you have your color off and your gain turned down too much, you can almost make the cord disappear. So you want to make sure that your gain is set at such so you can pick up the cord and then put on color. Some systems, particularly in small offices, don't have an option for color. So if you don't have color, just make sure that your gain is up high enough to be able to detect cord. So I'll come down here. Here's a nice pocket. We can throw on color. Quadrant 2. So that right there, she's already got an AFI of 9. I already know it's normal. We want an AFI greater than 5 or less than 25. Let's take off color. We'll go over to this quadrant. Not so much over here. So there's a little bit. Go to calc package. This is quadrant. There we go. Quadrant 3, another 4. She's got 13 so far, and we're moving up. And this is where the baby's bottom end is. Not likely to get a lot of fluid there. So don't be afraid to have a pocket with no fluid. It's okay to, sometimes the baby's in a position where there's actually no pocket in certain areas, and there's a bigger pocket over here, and that's fine. So like for this one, this is a very, very small pocket, still able to take some. So our overall AFI is 15, which is good, looks normal. So we still want to see some movement and tone. So we've just had our third episode of movement. And so for tone, I like to either go to like a knee, a foot, the spine, and see if I can't get the baby to kick. Sometimes you can push on the baby like this, and she'll kick you back. This is a nice foot. Looks like she's holding on to her foot. It's her little fingers. Oh, there you go. So if you see the foot disappear and it will come back, that would be an episode of tone. So waiting for tone, let's just go to a knee, lower leg, or foot and see if we can't get the baby to. Sometimes your mom, if she's very accommodating, she'll press on her belly for you like Elizabeth does for me. We'll see if she'll react. Tone is one of the more difficult things to get. You just have to catch, because sometimes you'll feel it. You'll know the baby just kicked, but you didn't capture it. So the best way to capture it, and if that's the case, you can count it, but the best way to capture it is with a cine clip. So just record the breathing and record the motion, because it's hard to document it on just a still frame. So the other thing that they do is when they can take their hand and kind of extend it and ball it up. That would count. It gets really hard. So here's a hand, as you can see. Let me use my pointer here. These are some fingers and a thumb. See how the hand is just in that sort of open position. Let's see if we can wait and see if she will either stretch her fingers or close her fist. There, do you see how she just closed her fingers? It's perfect. Let's see if she'll open them again. Also, if they don't do it in 30 minutes, you just can't give her points for it. So she can actually get a 6 out of 8 instead of an 8 out of 8 and still pass, but they just want to be aware.
She says it's nap time.
She's resting. Sometimes we'll get, patients that have just been medicated and they come down for their biophysical profile and the baby's like, out. So wake up the baby. All right, there we go. So that's the foot pointing. You can see it pointing and flexing. Excellent. Did you see that? So now it's flexed again. So pointing of the foot and flexing, that counts. Great. So 1 episode of tone, that's all we need. We got that. Great. So that covers tone. Let's get an M mode tracing of the heart. So we know the position of the baby, heads down. Chest would be right about here because we know where the baby sits. So we will take an M mode tracing. You want to put your little indicator here right over the valve. And it's a beautiful trace. We'd use our calc package. And this system uses a 2-beat measurement, so we have to actually skip a beat. And so 132 beats per minute, perfect. And that covers our biophysical profile. So we got an M mode of the heart, fetal position, head down, maternal, the lies to the maternal left, limbs are over here, anterior placenta, which looks like grade 2. We've sort of stopped grading the placenta at this point, but some people still do it. So the placenta is in this position, anterior, no previa. I can see the end of the placenta here. AFI looks good. Breathing, we saw 3 episodes of movement and 1 episode of tone, which was the pointing and flexion of the foot. So that covers the biophysical profile.